My name is Skip Mark. I am a professor of political science at the University of Rhode Island. I teach human rights, international organizations, and conflict. Today I want to talk a little bit about international organizations, cooperation, and COVID-19. Right now we are in the midst of a global pandemic. The COVID-19 virus is spreading beyond the control of governments. As of April 15th, we see over 125,000 deaths globally. And as this graph from Our World in Data shows, things are likely to get worse before they get better. That is, deaths look like they are increasing exponentially. All of this suggests that we really need to be paying a lot of attention to international cooperation and thinking through the ways in which the international community can come together and fight this global crisis. We know that when states work together to accomplish tasks, they can be more efficient than when they go it alone. And we've already seen quite a lot of evidence of international cooperation emerging globally. So first, we've seen a lot of examples of government-to-government assistance. So China, on March 13th, sends over medical equipment and expertise to Italy to help them deal with the pandemic. Russia sends over a number of planes filled with experts, medical equipment, pharmaceuticals, and Cuba sends over doctors and nurses to help in Italy. And we've seen a lot of this globally, where governments are sending to support to others who are struggling to contain the pandemic. The US is an ally with Italy. They also sent support. But here we see the US was pretty slow to do this. And it led to a backlash in Italy where people, rightly wondered, the US is our ally. Why are they not helping us? Whereas China, Russia, and Cuba are sending all of these supplies. So the timing of this matters quite a lot. And the US has not been particularly cooperative in the international arena. On another level, we have paradiplomacy. This is an understudied field in international relations. I got this information from a Duck of Minerva post by June Bang, a visiting scholar at USC. And this refers to sister cities. That is, cities across sovereign state borders who interact with each other. In the US, this comes out of President Eisenhower's 1956 Conference on Citizen Diplomacy. And the idea is that sister cities are meant to transcend politics. At the time, this was the Cold War, to create these positive city-to-city relationships between countries, right? And we've seen, a city in China sending hand sanitizer to a city in South Korea. Fort Wayne, Indiana, getting masks from a city in China. These sister city relationships are leading to help, expertise, and PPE transfers between cities that are not coordinated at the federal level. We've also seen a lot of work by INGOs and NGOs, that is, non-governmental organizations. So, organizations like Doctors Without Borders are continuing all of the good work they do around the world, but they've also expanded their efforts into areas like Italy, Hong Kong, and Iran, which are heavily hit by the virus. Human Rights Watch is a human rights INGO, and they have been raising awareness about some of the human rights implications that go hand in hand with the ways governments are dealing with the pandemic. So this is things like governments using the pandemic as an excuse to repress dissidents and those critical of the government, or the fact that some groups are far more likely to die from this pandemic than others. So prisoners in many countries have sort of been ignored and have suffered in very inhumane conditions as a result of this. Today I want to talk a bit more about international organizations. IOs are institutions whose members are made up of sovereign states. So the United Nations, the International Monetary Fund, the World Health Organization, the World Bank are some IOs you might have heard of. A lot of these come out of World War II. So the UN, the IMF, the World Bank, the World Health Organization. All of these are created at the end of World War II or right after World War II, as the international community sort of learned a very big lesson from the Great Depression and World War II, which is that when states work together, we can mitigate some of the damage of global crises. And normally, without these institutions, states have an incentive to go it alone, and that can make things a lot worse than it otherwise needs to be. So during the Great Depression, for example, a lot of states turned away from globalization, from working with other states, and pursued isolationist policy. And a lot of academics argue that this made the Great Depression worse than it otherwise would have been. At the time, and I think a lot of people would still agree today, there's also an argument that because the Great Depression was as bad globally as it was, it created situations that made World War II more likely. That is, one global crisis, if states go it alone, can make things far worse and spiral out into other crises. So IOs were created as a way to promote cooperation and coordination among states. Each IO has a specific mandate that it's given by member states. Okay, so one useful way of thinking about international organizations is what's called a principal-agent framework. So anytime you have someone delegating authority to someone else, we can often look at it through this principal-agent framework. So here, governments, who are the members of international organizations, delegate authority to an international organization to accomplish some task. And governments often have very different goals than the international organizations, right? So on the one hand, we have the problem that the World Health Organization is made up of 194 member states, right? And they may all have a very different idea of what an IO should do, when it should be punished, how much funding it should receive, and to the extent that they disagree with each other, the international organization doesn't really have a clear mandate. They don't know what they should do. So this can empower them to act on their own, but it can also make it really hard for governments to punish them if they act in ways that governments don't like. So we call this a collective principle. The principle here is, hundreds of sovereign states. We also have this problem that political leaders often prioritize their own survival. Leaders want to stay in power, and they use the tools at their disposal to ensure that they do so. This means that governments often have incentives to push IOs to act in ways that benefit them domestically, even if it is counterproductive to the mandate of the IO, right? So, leaders are using often tax money domestically to fund an international organization, and as a result, they need to justify why they are spending this money on an IO rather than on their citizens. And at a time like a pandemic, this can be really difficult, right? Why are you sending billions of dollars to the World Health Organization when we have so many people dying in the United States and underfunded hospitals? So that's two issues, right? Governments can disagree, which can make it unclear what the directive of a principal is to an agent, but governments can also use their power to push IOs to do things that undermine their mission. And this is particularly true of powerful governments like the US. International organizations may also act in ways that governments do not like. So an IO is a complex organization. There are a lot of agencies, there are a lot of individuals, and oftentimes we see disagreements within an international organization about how best to implement their mandate, what they are tasked with doing. We call this a collective agent. And the more disagreement there is, the less coordinated an international organization is, the more waste, the less efficient it is, and in general, the worse they are at accomplishing their task. So we assume IOs often want to expand their budget and their power. So the World Health Organization is a federal structure. It looks a lot like the US government. The highest level, we have the World Health Assembly, which is made up of 194 nation states, and they choose the executive board and the director general, who is sort of the head of the WHO. Below that, we have 6 quasi-autonomous regional offices, and below that, we have the actual country-level offices. One of the interesting things about the World Health Organization is that these regional offices have a lot more autonomy than in most IOs. That is, they're elected by regional members, so the director general cannot fire them, and they have a lot of control over the budget. That is, I think maybe a decade ago, regional offices controlled 70% of the WHO's resources. What this means is that the Director General and the states, which can implement pressure at the highest level, this World Health Assembly and Executive Board, are less able to put pressure on these regional offices. And as a result, we see a lot of criticism throughout the years aimed at the WHO, in particular because it's decentralized, because a lot of the things that they've been tasked with implementing result in waste, mismanagement, fragmentation, that there's a lack of clear vision, and that many WHO projects fail or have no effect as a result. So this is not the first health crisis the WHO has been criticized for, but what we really need to think about is, would things have been worse without the WHO? Not could they have done better? That is certainly something we need to consider, but if we get rid of the WHO, would things have been worse? So let's start with the good. So the WHO has taken a leading role in information dissemination. They've offered a lot of good advice on how to behave, what to expect. They've been a very useful source of information when governments may not have been or may be disjointed. They've done a lot of work briefing public health officials about which policies are successful, which are not. So they've been able to coordinate a lot of information from all of their various country-level offices in a way that no single government could do. So in terms of information sharing and coordination, they have done a lot of really good work. They also have thousands of personnel on the front lines, offering guidance, trading, equipment, services all around the world. And, a lot of health experts and people who have been paying attention note that the WHO has done a lot of good. Without them, things likely would have been far worse. Once the WHO called COVID-19 a pandemic, governments around the world took notice and changed their behavior. So without the WHO, a lot of governments would have been much slower to act, and it would have been much harder to coordinate information and successful policies. So the bad, right? Because the WHO is an agent and they are tasked with implementing the goals of a principle, we often see governments use their power to push IOs in a way that goes against their mandate, right? So China is the second largest contributor to the WHO, and there are already quite a lot of allegations that China used its influence to prevent the WHO from sort of sounding the alarm about this pandemic earlier, that they had a lot of good information, that things were worse than China was letting on, but they didn't say anything. And at the regional and country level, we know this is because, well, number one, IOs are agents, right? They need to do what their member states tell them. The member states are the ones who fund it. But number two, that states often step in and push IOs to do things that otherwise would be considered inefficient. So, plenty of allegations that the WHO kind of messed this up in the beginning. So here's a quote from Regional Director Dr. Takashi Kasai on January 24th. He says, I myself was involved in the SARS response. I can confidently say this is different for two reasons. One, China. The country has a much, much stronger capacity. The fact that China detected this disease and were able to identify this was caused by a new strain of coronavirus, and more importantly, shared that information with other countries is evidence for that. And what we see is the regional director, praising China. We see the director general praising China and saying they've got this under control until they don't. Lawrence Gostin, a professor of global health at Georgetown University, gets quoted as saying, "We were deceived. Myself and other public health experts, based on what the World Health Organization and China were saying, reassured the public that this was not serious, that we could bring this under control." So a lot of the criticism right now is that the WHO acted too slowly. They bowed to pressure from China, and make no mistake, if this had started in the U.S., the U.S. president also would have downplayed this. Elected officials have an incentive not to be held responsible for a pandemic, and pandemics can create panic. So leaders often have an incentive to downplay these things, which is one of the reasons why we have an international organization dedicated to health, right? The idea is that this organization should be above politics and should be ringing the alarm bell. So this is certainly something we should be criticizing the WHO for. But we have to recognize that unless we give the WHO more power, maybe change its funding source, this might be sort of an inefficiency we have to live with. So a lot of blame going on at the WHO right now. So here are a couple of news headlines, right? Chinese officials note serious problems in coronavirus response. The World Health Organization keeps praising them. That's early February. Jump to April 8th. Under fire for COVID-19 response, Trump says WHO really blew it. We're getting to the blame game, right? Who's responsible for this? And leaders have an incentive to make sure it is not them. April 14th, Trump halts funding to the WHO. It's not clear he can directly do this, and there's some debate about what this will actually look like. But Trump has basically said the WHO blew it. We're not going to continue to spend money on them. Instead, let's spend money at home. And this is always what we see during a crisis. These international organizations come under fire. So what are some takeaways? If IOs are always coming under fire during crisis, one of the benefits of this is that after the crisis is over, there's a lot of push for reform. In terms of the WHO, which we've talked about here, the funding and institutional structure of the institution probably could use some reform. And in particular, centralizing authority so that regional directors do not have as much autonomy might be one way of reducing waste and mismanagement, but also ensuring that powerful members can't divert the organization for their own purposes. So another takeaway is powerful member states do divert IOs for their own purposes. And oftentimes, a lot of the criticism we have for international organizations comes from this interference. So in particular, when powerful states like China or the US interfere in international organizations for domestic political gain, these organizations don't function as they should. A third takeaway, and a really important one here, is that we should be under no illusion that international organizations are responsible for what's happening, right? What we're really seeing is that the WHO could have done a better job at the beginning of this pandemic, but we should be under no illusion that without the WHO, things would have been better, right? International organizations have improved cooperation and coordination among states during this pandemic. Things would have been much, much worse without the WHO ringing the bell that this was a pandemic. If each state had to make a decision on their own based on what other governments were saying, we would have much worse outcomes. Finally, even though international organizations have made things better, they also hold some responsibility for bad past policy, internal divisions, and putting politics over need. At least some of the failure in global responses to this pandemic can be blamed on IOs. But right now is not the time to sort of blame IOs, I think. Right now is the time to promote international cooperation by empowering IOs, by empowering government-to-government transfer, by empowering paradiplomacy, and by helping INGOs and NGOs do what they do best. So I hope you've enjoyed this. Once again, my name is Skip Mark. I teach at University of Rhode Island in the political science department. Thank you.